Did you know that in 2000, about 40% of all bankruptcies in the United States were due to medical bills? In 2024, that number is now 66.5%. If you look at this map above me, you can see that the same percentage for other countries is much lower than the US, including countries like the People's Republic of China, which has over 3 times our population, yet has 0% medical bankruptcies because they have single payer healthcare. When I was 13 years old, I was riding my bike and I got hit by a car. And I still remember, even at the age of 13, that my fear was not being hurt from being hit by a car when I got hit. My concern was how expensive the ride in the ambulance was going to be. I still remember that today, that there was this ingrained fear of healthcare costs, even at such a young age. That was the only time I've really been concerned about my health. There are other people out there with chronic illnesses that they have gotten through no means of their own. Some of them have congenital diseases, some of them have syndromes or disorders, and they have to pay a lot more in healthcare costs than I have to. And some of them aren't able to afford those costs. Some of them become homeless as a result. Essentially, what I'm trying to say is that I have very little sympathy for health insurance companies, and I personally don't believe that they need to exist. There already exists a better system that serves more people who require more healthcare needs more efficiently and more cost effectively, and that benefits more people as a whole. If that system can exist in another country, it can certainly exist in a country that is richer, more powerful, with more capable healthcare professionals. The problem with health insurance companies is that their primary motivation is to make money to benefit the shareholders. However, this also means that if they are presented with a choice between giving someone the care that they need and benefiting the shareholders, most of the time they're going to choose the latter option as opposed to giving someone the care that they need, which means that inevitably people go without receiving the care that they need to survive. The other dark reality of this is that the United States, as a capitalist country, is a consumerist culture, which means that people who are happy, healthy, and content with good, strong communities don't spend nearly as much money as people who are unhappy, unhealthy, who live by themselves and are discontent with life. Think about it. Think about the lives that we live. We live a life that isolates us from our community. We live a life where we're supposed to work until we're overworked. We live a life where we're supposed to consume, consume, consume. Keep buying things to help satiate that lingering feeling of emptiness for a short period of time until that passes and we need to keep buying again. And that sort of lifestyle, which is very common in the United States, will inevitably compromise your health. And I think about it all the time. I think about how we live in a country that essentially does not want you to be happy. They do not want you to have a sense of fulfillment because once you have that, well, you're no longer profitable. And if you're no longer profitable, well, you're not considered useful. Not only that, but think about the type of lifestyle that people are missing because they're concerned about healthcare costs. There are people out there who want to try new things, live new lives, not have to worry about paying bills. There are so many people who, again, are becoming bankrupted by their medical bills, young and old alike. There are people right now who want to start families that can't afford to do so because it's too concerning for them. They don't have the ability to pay for the health bills. I have several personal goals that I would love to see fulfilled. I want to reduce the abortion rate in this country. I want to reduce the self-end rate in this country. Yet, to do that, the easiest way to do that, the most effective way to do that, and the most comprehensive way to do that is to make healthcare more affordable, and that usually means a single payer version of healthcare. But that would make health insurance providers, well, irrelevant. It would make them unprofitable because happy, healthy people aren't profitable. For that reason, they lobby our government to make single-payer healthcare to be considered as unrealistic or infeasible, when in reality, it's something that we can do and that we would ultimately be spending less money on. For that matter, 60% of American bankruptcies are related to health bills because health insurance companies need to make a profit and they don't want us to live lives that are healthy.